Remodulin, treprostinil uses, mechanism and side effects explained. What is Remodulin, treprostinil? Remodulin, also known by its generic name treprostinil, is a medication in the prostacyclin analog class. It's prescribed to treat pulmonary arterial hypertension (PAH) in adults, a serious condition where high blood pressure affects the arteries in the lungs and the right side of the heart. Remodulin, treprostinil, is administered as a continuous subcutaneous or intravenous infusion using a special medical pump. This allows the medication to maintain stable levels in your body for effective symptom control. Common side effects may include pain at the injection site, headache, and diarrhea. The medication is available as both a brand name and a generic option. What is Remodulin, treprostinil used for? Remodulin, treprostinil, is approved for the treatment of pulmonary arterial hypertension (PAH), classified as WHO Group 1 pulmonary hypertension. The goal of this therapy is to improve exercise capacity, ease symptoms such as shortness of breath and fatigue, and slow disease progression. How does Remodulin, treprostinil, work? Remodulin is a prostacyclin analog, meaning it mimics the natural effects of prostacyclin, a hormone produced in the body that helps dilate blood vessels and prevent blood clots. In people with PAH, the pulmonary arteries are narrowed, making it difficult for blood to flow through the lungs. By relaxing and widening these blood vessels, Remodulin reduces pressure in the lungs, improves oxygen delivery throughout the body, and decreases the workload on the heart. This mechanism helps patients breathe more easily and maintain better physical function. What are the side effects of Remodulin, treprostinil? Like all medications, Remodulin, treprostinil, may cause side effects. Some symptoms are mild and tend to improve over time as your body adjusts to treatment. However, you should contact your healthcare provider if these effects persist or worsen. Common side effects, especially with subcutaneous infusion, include pain or tenderness at the injection site, reported by up to 85% of patients, redness, irritation, or swelling at the injection site, around 83%, headache, 27%, diarrhea, 25%, nausea, 22%, skin rash, 14%, jaw pain, 13%, dizziness or lightheadedness, 11%, swelling in the hands, feet, or ankles, 9%. Important note: Remodulin, treprostinil, should only be used under the supervision of a healthcare professional experienced in treating pulmonary arterial hypertension. Your care team will determine the correct dosage, provide training on infusion pump use, and monitor for any adverse reactions or infusion complications. Typical dosing for Remodulin, treprostinil. The dosing of Remodulin, treprostinil, is based on your body weight and your individual response to treatment. The usual starting dose is 1.25 nanograms, Ing per kilogram of body weight per minute, delivered continuously through an infusion pump. This infusion can be given under the skin, subcutaneous, or into a vein, intravenous, depending on your treatment plan and tolerance. Your healthcare provider will determine your starting dose, monitor how you respond to treatment, and carefully adjust your infusion rate to find the dose that provides the best balance between effectiveness and side effects. If you have liver problems, your dose may need to be lowered since treprostinil is processed through the liver. Always follow your provider's instructions closely and never adjust your dose on your own. Pharmacist tips for Remodulin, treprostinil. Your healthcare provider or pharmacist will give you detailed instructions on how to prepare, handle, and administer Remodulin, treprostinil, safely. Here are important guidelines to keep in mind. Medication preparation. Depending on the concentration, you may need to mix Remodulin with a sterile liquid called a diluent before starting your infusion. Follow your provider's directions carefully regarding dilution and storage. Check the solution. Before use, always inspect the Remodulin solution. It should be clear and free of flakes or particles. If you notice any cloudiness or discoloration, do not use it. It may be contaminated and unsafe. Do not stop suddenly. Never lower or stop your infusion abruptly without medical guidance. Sudden interruption can cause your pulmonary arterial hypertension, PAH, symptoms to worsen quickly, leading to shortness of breath, dizziness, or fatigue. Backup equipment. Always keep a backup infusion pump and necessary supplies available. If your pump malfunctions or stops unexpectedly, you'll need to continue your medication without interruption. Bleeding precautions. Remodulin, treprostinil, can increase your risk of bleeding, especially if you take blood thinners or have bleeding disorders. Contact your healthcare provider if you notice unusual bruising or bleeding that doesn't stop. Medication safety. Once a vial of Remodulin has been opened or punctured with a needle, discard it after 30 days to prevent contamination or reduced potency. Remodulin, treprostinil, is a vital, life-sustaining therapy for individuals living with pulmonary arterial hypertension. Correct dosing, safe preparation, and consistent infusion management are key to achieving the best outcomes. Always stay in close contact with your healthcare provider, and report any side effects or equipment issues right away. If you found this information helpful, don't forget to like this video, subscribe to HeInfo, and turn on notifications for more science-backed explanations of medications and treatments. Your health deserves trusted, expert guidance, and HeInfo is here to provide it.